The evolution of the true form tummy tuck began perhaps 25 years ago. Generally speaking, I was dissatisfied with the way in which I had learned the tummy tuck and the results that were standard at the time. Oftentimes, the patient looked very artificial. The abdomen was flat as a board. There was no real character. It did not look natural. It did not look athletic. It just looked like skin was removed and tightened, and I generally felt it was unimpressive. So I began working on a few elements of the tummy tuck in order to create a more natural, aesthetically appealing effect. A more athletic, toned abdomen that had some character, differential thickness of the tissue over the abdominal wall. So there are several elements that are involved in this process. So this is the oblique view, and this is probably the most important view of the tummy when taken before and after, because you can see so many things with it. And it highlights the detail, it highlights via shadows, it highlights the natural lines of the abdomen. And this is what I'm trying to accomplish every time when I do the true form tummy tuck. And the tools that I have for doing this are number one, differential fat thinning. That is, I don't want the fat over the entire abdominal wall to be the same thickness. I want there to be some differences between one area and another so that we can highlight the natural lines. We can highlight and demonstrate the lines that separate one muscle group from another. And you can see that in this patient very, very distinctly. This is called the linea alba, which is that nice soft valley in the midline. This is called the semilunar line because it has kind of a half moon shape. You can see that the fat in these areas have been thinned more specifically than the area in the center of the abdomen, the lower center of the abdomen. In addition, the area over the external oblique muscle has been thinned a bit more so that there's a nice soft cavity in that area. And when the fat is thinned in this differential way, you can see the natural lines underneath it that separate, like I said, the muscle groups. This is called the rectus muscle. This is called the external oblique muscle. This is a very natural looking abdomen, one in which a patient is not going to be reluctant to put a two-piece swimsuit on. And that's always in the back of my mind as a goal of the procedure is something a woman can be proud of and feel comfortable and confident in putting a two-piece swimsuit on. In addition, on this view, you can see the belly button. The belly button should have depth. You should see a shadow on the inside of the belly button. It shouldn't be on the skin surface. It should actually be internalized. And the scar should be along the inside perimeter of the belly button so that it's inconspicuous. It should also be slightly vertically oriented because that's the most aesthetically appealing belly button. So you can see this, all of these features of the true form tummy tuck in this patient. Oftentimes, a patient is reluctant to have a tummy tuck because patients or the friends that she's seen have an artificial appearing belly button with a large circle scar around the perimeter. And it's often very unaesthetic. What becomes obvious is the round belly button with the scar like a donut around the perimeter. And that's just an unacceptable appearance for most patients. So there are actually 6 maneuvers that I make during treatment of the belly button during the true form tummy tuck in order to create depth, a relatively vertical or slightly oval appearance, and tucking the scar in along the inside edge so that it's not apparent. In addition, you can see that the waist area has been treated at the same time because a flat, athletic appearing abdomen does not harmonize with a waist that's full. So we really have to think about more than one area when we're treating the abdomen in order to create a proportioned, natural look where one part of the body matches another part of the body. And this is the best way I found to make the patient look less surgical and more natural. So liposuction is performed in the waist to create that nice concavity in the waist. The area of the back is often treated at the same time so that those difficult bra strap bulges are eliminated. The two primary tools that are used to create this sculpted appearance are differential sculpting of fat, that is, specific thinning of the fat pads in the area where the muscles fuse, like the semilunar line and the linea alba. And secondly, the use of progressive tension sutures during the procedure. Progressive tension sutures are a technique that's been around, that I've been doing for about 24 years since the original paper was published by Dr. Pollack in Dallas. And it's been a wonderful tool to implement during tummy tuck surgery. It allows me to do this procedure without using drains. The space between the skin and the underlying muscle is closed off with progressive tension sutures so that fluid can't collect following surgery. And this allows me to do the procedure without drains. In addition, I've adapted the progressive tension sutures in such a way to assist me in defining anatomy. The progressive tension sutures are placed in a very specific way along the midline in order to create depth of this line, the midline valley, as well as along the semilunar line. So they have a dual purpose for the true form tummy tuck. The first purpose is to eliminate the need for drains, and the second purpose is to define anatomy. So I call those sutures anatomy defining progressive tension sutures. I know that's a long, big word, but it's an important aspect. It's an important tool that I use in order to create this kind of look. Most women will have some separation of the muscle wall after having one or more children. And sometimes it's a very, very minimal separation of the muscle wall. Other times it's a very wide separation. It can be 2 inches, sometimes 3 inches. I'd say most commonly though, it's about a 1 inch separation. And that is what gives rise to the forward bulge of the abdomen, this projection that is reminiscent of pregnancy, is the residual from having carried a child. And you can see it both on the upper and the lower abdomen. You can see here, when the diastasis is repaired, there is a very nice contoured line where there is a slight concavity of the upper abdomen and a slight convexity of the lower abdomen. That's that soft S appearance after diastasis repair. And you can see from this view as well, the semilunar line, this area of fat has been thinned in order to create that definition, that three-dimensional appearance, that shadow, if you will, that looks very natural and athletic. In the posterior view, the back view, a nice concavity is created by thinning the fat pad with liposuction in that area. I might also note that in some patients, we also do fat grafting of the buttocks. If the buttock has lost volume and or the patient would like a rounder buttock, then that can be performed as well during the same procedure. So those are the elements of the true form tummy tuck and the way that I conduct the procedure, the way the procedure has evolved over the last 25 years. So thank you very much.